This is Indrani Paul. Today I will be presenting on a topic that has long been under-recognized in perinatal care, and that's the paternal mental health during the transition to fatherhood. So here what we will explore today. We will begin by defining the paternal mental health and its importance, followed by a look to the data, revealing its hidden burden. And we will also unpack key risk factors, examine the consequences of inaction, and discuss opportunities to strengthen our perinatal care frameworks. And finally, I will close with some recommendations and reflections for future directions. Next slide, please. So, what is paternal mental health? So, it's a father's emotional and psychological well-being, particularly during the transition to parenthood. And unfortunately, this period of adjustment is often overlooked for fathers. While maternal mental health has rightly received attention, many fathers silently struggle. And untreated paternal depression is linked to impaired bonding with the infant, emotional distress in mothers, and behavioral issues in children also. And fathers are deeply affected by the same stresses and life changes that new mothers experience. And yet, societal norms often silence these challenges. Next slide. So, the hidden crisis in numbers. The numbers tell a powerful story to us. 1 in 10 new fathers in Canada experiences postpartum depression. That's match the rates seen in mothers also. And nearly 22% report high level of anxiety and depression within the first year of their child's life. The risk of depression is up to 50% higher for fathers in this period. And anxiety rates increase by up to 17%. And the global estimates align with this trend, showing a 5 to 10% prevalence of paternal depression during the perinatal phase. And clearly, this is not an isolated or rare issue. It's a widespread public health concern. Next slide. So, unpacking the risk factors now. Multiple factors contribute to poor paternal mental health. Financial stresses and unemployment are the common triggers among fathers. A lack of social or emotional support, especially in isolated nuclear families, make the experience more challenging. And also, unplanned pregnancy, substance use, and even infant sleep problems have been shown to increase the mental distress in fathers. Recognizing these risk factors is key to building timely interventions. So now, what might be the consequences of neglecting paternal mental health? Ignoring mental health has several effects, not just for the father, but also for the entire family. It can strain family relationships and impair the healthy child development, and lead to emotional and financial stress that spans generations to generations. When fathers are not well, families are more vulnerable, and addressing these issues early can prevent a lifetime of challenges. So, what can we do? First, we must include fathers in routine perinatal mental health screening. The gender-sensitive interventions should be designed especially for them. And healthcare providers need training to recognize psychological distress in men who may experience it differently than women. And the public health campaigns and programs must actively include fathers and support systems that should engage both parents to improve the outcomes of the whole family. So, to move forward, Canada needs to invest in research that focuses specifically on paternal mental health. Policy frameworks should be inclusive of fathers, not just mothers. And the community-based programs, especially those that are culturally responsive, must be expanded. And reducing stigma through public campaigns is essential also. And finally, longitudinal research will help us to better understand the long-term outcomes for families when paternal mental health is supported. So to conclude, paternal mental health is not a secondary concern. It's essential to family health. As we aim for inclusive perinatal care, we must acknowledge and address fathers' mental health needs. And by supporting paternal mental health, we will be able to build stronger families and healthier future generations. Thank you.